For me, graduating from medical school and finishing up residency is like being at a crossroads. It's not just about a career or a way of providing for my family, but it's really thinking about the kind of doctor I want to be. Hi, I'm Richard Bruno. I am a Students to Service participant in the National Health Service Corps, and this is my first day at my first real job after residency. I was just joking with my daughter. She's 8 years old, and I was telling her I just finished 24th grade. I'm psyched, I'm ready to go. It's my first day of orientation.
Good morning. Welcome to Baltimore Medical System. Our motto here at BMS is that we take care of all patients, regardless of their race, creed, or circumstances.
The decision to come to a certain clinic is a tough one. I mean, I think it really behooves a medical student or a resident who's thinking about going into underserved care to go and visit a clinic, to actually go and try and either shadow or work at the clinic or do a rotation at the clinic to see if that's a good fit for them. The National Health Service Corps will pay for you to come and do an interview and check out a site visit, which is an opportunity I would encourage folks to do if they're thinking about it. Did I blink? Okay, great. When I was looking for sites, as I was finishing up my residency, I started by looking on the website and making sure that they met the health professional shortage area criteria, looking in certain regions of the country that I knew I would potentially want to work, and then just kind of scouting out some sites and some statistics about the sites. Baltimore Medical System was one of the best sites that I looked at.
Dr. Richard Bruno stood out to me first on paper because of his public health education, his strong desire to work with a disadvantaged community. He truly wants to make a difference.
It is a stressful time. There's a lot that you have to do to become a provider. It's not like I graduate one day and I start my position the next day. So there are a lot of different licenses you have to apply for. There's the privileging, there's credentialing, then there's all the HR information that's needed to get started. And to help ease that transition to NHSC service, we really look at trying to simplify the process of bringing the provider on board.
I love Baltimore. Part of the reason I wanted to come to Baltimore in the first place is that my wife's family lives out here in Maryland.
Good job.
My wife and kids have been very supportive over the last few years, you know, especially going to medical school, going to residency, living pretty meagerly and accruing, you know, hundreds of thousands of dollars of debt. You see the kitty cat? Knowing that I can stay in a place that I've already developed roots in was really important for me. So coming to residency and then continuing on with my National Health Service Corps commitment, it seems like a really nice, fluid transition. So many times I was thinking to myself in medical school, I really want to come to a population that's diverse, that has a lot of different medical problems and conditions, and I found it in Baltimore. Two of my big issues are opioids and obesity, the two O's, and we have those here in Baltimore, unfortunately. They're two very challenging, very complex issues. You help him brush his teeth? Yeah, that's sweet. So it's really important, I think, for primary care docs to be very integrated with the behavioral health folks who are working with us to help our patients be more productive and overcome the struggles. And I think that's a really beautiful way to do it.
I didn't know about the carbohydrates.
I know, sugar hides in a lot of stuff, right?
Yes.
Dr. Bruno was very passionate in our first discussions about the volunteer work he's done and his desire to focus on patients in the city of Baltimore.
What's your favorite class this year, you think?
Nursing.
Nursing. Oh, that's cool. We need all the doctors and nurses we can get.
He really wants to help them take a more active role in their own health and improve their quality of life and reduce their hospitalizations, really help them to be their healthiest self.
Good luck. Hope you enjoy that nursing class. Parks RX is basically a prescription for patients to walk in the park with their doctor. So we're planning to do a walk with people during a lunchtime hour, and we're going to take them out into the nearby park right next to the clinic so we can really get out there and have a great way of exercising, getting some physical activity. Convening, you know, as a neighborhood has been a wonderful help to be able to do the National Health Service Corps program and fulfill my sort of great mission in life as being the kind of community doctor that a community needs. It's a win-win.